there's different ways to move teeth through bone. A very efficient, effective way is to use brackets and wires to move teeth. A lot of patients choose that way. One, because it's the advantage of it, it can cost less than doing clear aligner way. I sometimes prefer it because there's some movements that I can perform better with brackets and wires that I can't do with aligners. Now, Invisalign is a brand. I don't use the brand Invisalign. I use OrthoSnap itself. But the reason why is actually, I'll come back to that in a second. But I wanted to go back and talk about more of the difference between braces and aligners. With our system of the braces that we're using, we're able to get results on an average of 12 to 15 months, getting the bite right, getting the teeth straight, and getting a beautiful smile when the patient's done. They're very happy. The disadvantage is that you have the metal brackets and wires, and they can disturb your lip and your cheek and your tongue. And you get wires that can poke out sometimes and poke you, and they bother you, and you have limitations on what you can eat or drink. You have to wear elastics because that's part of the movement as well. It's not just the brackets and wires, it's elastics as well. So I asked the patient, I was like, look, I can only do half the battle here. The other half is you making sure you're wearing your elastics and keeping your teeth clean. So we're able to get phenomenal results with that, and patients are choosing braces to get the movements that are needed for their case, and there are some patients who choose aligners. Now, there's a misconception that, oh no, that's going to be easier. I'm going to choose that. What I've learned early on, got training with Invisalign back in 2002. I was actually at one point frustrated with the aligner process and stopped doing it. And that's why I learned to do brackets and wires, because it was more predictable and I can get the results I wanted to get and what the patients wanted to receive. I can look at the patient and confidently say that we're going to get it. What's the variable that happens when we use aligners? The patient has to wear them. So I look at a patient like, look, if you can't tell me that you're going to keep this in your mouth 22 hours a day and only take it out to eat and put it right back in after you brush your teeth when you're finished eating, this is not going to work.